Hey everyone, today we've got another heart. This is number 423 in our collection. You can see this is a larger heart than we usually have. And so the heart's a little differently oriented just because of how it would sit. So anterior is here, superior is actually here, posterior is back here, inferior sitting towards the turntable, left would be here, right would be here. So a little differently oriented than normal just because of the size of this heart and how it sits on the turntable. But why don't we go ahead and move it and try to find what seems to be the right atrial appendage, at least externally. And here we find an atrial appendage that's triangular in shape, broad-based, or pyramidal in shape, which is consistent with what a right atrial appendage is like. So we'll go ahead and open the heart there. And when we do open this heart, we do find pectinate muscles that spill outside the confines of this appendage, consistent with a morphologic right atrium. And when we look here at this atrium itself, we find that the oval window or oval fossa is intact. There is no atrial septal defect. And here we find the coronary sinus right here. And here is the tendon of Totaro. All important structures because the coronary sinus, the tendon of Totaro, and the septal leaflet of the tricuspid valve form a triangle known as the triangle of Koch, and at its apex is where we would expect the atrioventricular node or AV node to sit. So coronary sinus, tendon of Totaro, septal leaflet of the tricuspid valve, and at its apex is where we would expect the AV node to sit. Now, when we look at this right-sided atrioventricular valve here, we find that it does have 3 leaflets, and then there's one here that's kind of transected. It does have septal connections, thus consistent with the morphologic tricuspid valve. When we look at the ventricle that it leads into, we do see coarse trabeculations. And then we do find a septomarginal trabeculation here. And within the confines of the septomarginal trabeculation, we do find an outlet-type ventricular septal defect. And this is an outlet ventricular septal defect because it does live within the Y of the caudal limb, the caudal band, I should say. So between the cranial and caudal limbs of the septomarginal trabeculation, so an outlet ventricular septal defect. And you can see that this border in the posterior-inferior portion of the ventricular septal defect is muscular. Now, when we get to the actual arterial trunk here, we see that it is guarded by a 3-leaflet, 3-sinus valve. It is kind of thickened and dysplastic appearing. You can see how thick the edges appear here. And immediately we also find 2 orifices here, which are leading to the left and the right pulmonary arteries. And then if we do look over here, we do find the origin of a coronary artery right here. So we find that this in fact is a common arterial trunk. Remember the definition of a common arterial trunk being a single arterial outlet that gives rise to the pulmonary arteries, the ascending aorta, as well as the coronary arteries, which is in fact the case here. And so this truncal valve has 3 leaflets, is dysplastic, and we find that the pulmonary arteries arise side by side, but from separate orifices here. And once again, here is the left pulmonary artery, and here is the right pulmonary artery. Here is the ascending aorta, and then we do have head and neck vessels that branch off here. Right. So now if we turn this heart around and go to the posterior aspect of this heart, we find a smooth vestibuled atrium here consistent with a morphologic left atrium. We do find externally what appears to be the morphologic left atrial appendage. And here is the mouth of the left atrial appendage here. And you can see that the pectinate muscles are all confined within this appendage itself, consistent with the morphologic left atrium. When we look at this left-sided atrioventricular valve, we see that there are two leaflets. Here's an anterior leaflet here and a posterior leaflet here. There are no septal connections of this valve here. Here you can see the anterior leaflet has no septal connections, consistent once again with the morphologic mitral valve. And here we find another ventricle with fine crisscross trabeculations, consistent with a morphologic left ventricle. When we try to look down inside this ventricle, we find that its only egress is through this ventricular septal defect that we've seen before. And it's somewhat hard to tell from here, but you can see that there's actual overriding of that common arterial trunk, so it does arise from both the morphologic right and left ventricles. So to kind of take a peek at the common arterial trunk portion of this once again, here we find an outlet ventricular septal defect with a muscular border. We find a 3-leaflet truncal valve that is dysplastic, and we see 2 branch pulmonary arteries that arise from separate orifices, and we do find coronary artery arising from the sinus of this outlet, and of course the ascending aorta as well. So a large heart with a common arterial trunk that has pulmonary dominance, aortic dominance, and branch pulmonary arteries that arise from separate orifices from the posterior aspect of the common arterial trunk.